Hi, Mark, and
Brian here.
the patient who we
You
just had, and they didn't make it, but they donated their body to us.
What a nice guy.
So, what I want to talk about this month, this is something I've been seeing a lot of, and that is low back pain, and getting a lot of patients that got the pain radiating down their leg, some of it to the knee, some of it to the ankle, some even into the foot. But this seems to be a big problem right now based on the type of patients we're seeing. So I've got a lot of them coming in and they're all complaining of the same thing: back pain, radiating pain. So that's what we want to address. Typically, what we want to go over is causes and then some prevention exercises that you can do to help this. So not only preventing it in the future, but how to deal with it if you get it. The biggest culprit nowadays is sitting posture, sitting rounded. And sitting rounded, a lot of people tell me, well, I'm sitting up straight. And it may look like they're straight, and we're going to use this as a demonstration. So normal posture in your low, this is your low back from the right side, should have a slight curve to the back of it. So you're bent here. A lot of people, when they sit though, their spine does this and becomes more straight. And that's what we're meaning by a straight back. Okay? Just like this. So it may look like from the side that you're sitting up tall, but you've lost that reverse curve here. That is a neutral, relaxed position of your spine. So the sitting postures, because so many people are working on computers and that nowadays, sitting prolonged in those postures is one of the biggest culprits for why backs break down. So, Brian, I'm going to demonstrate here what we're talking about. So, go ahead and have a seat in that chair, if you would. So, what I was talking about at first, you're sitting here like this. When people sit, normally then they start getting a little bit lax, and then they start slowly slouching a little bit, and their back starts rounding a little bit. They're hanging on to soft tissue. And then typically they can start getting pain while they're sitting there, or another complaint is when they're getting up. So when they stand, because these tissues now are a little bit looser, more lax, and when you first stand, they're not supporting you as well. And then you get pain, and then people say, I have to stand there for a minute or two, or I have to walk around a minute or two for it to start feeling better. That's because your back is rounded, just like here. So the big key is you want to sit up straight. Now, if you don't have a back support, okay, here's what I want to show you how to find this position. So sit about halfway back in the chair, Brian, please. So what you're going to do, you're going to slouch and go to this position. So you're going to find the end range of that bent forward position, and then you're going to take and arch your back to the end range of this position. So you go to the two extremes of that. So the rounding forward, the rounding back, and then after you've rounded back, you come forward a little bit and relax right into that posture there. Now Brian's got this reverse curve here. That's the neutral position of his back. This is how you want to try to sit when you are sitting with no support, meaning your back is not against the backrest. The ideal situation is using a backrest and a lumbar support. So a little rule, you can make it out of a towel. They have commercial ones you can buy, but you would slide your rear all the way back against the seat. You would put this in the small of your back and lean back against it. It puts you on a slight angle back, puts your back in a neutral position, which not only helps your low back, but your neck and your shoulders. Because now all these structures back here are in a relaxed position. As good as that posture is, though, still every 30 minutes you need to stand up 5, 10, 15 seconds, do a few back bends. If you can walk around for a few seconds, that's even better, but at least get up, reverse the posture, and sit back down. We've had patients come in and say they haven't moved out of their desk for 6, 7 hours. So you're causing breakdown, and you want to get to that. So what we're going to address in the exercise parts of this, if you start developing back pain, then you want to try to get that under control immediately. The longer you let it go, sometimes the harder it can be to deal with. And go ahead and stand up, Brian. We'll put you back to the camera, please. So what we're going to talk about, back pain a lot of times will start here. Then it can spread out to the sides, or it can go to one side. Then it can start traveling down to here. It can travel to just above the knee. It can travel down to the ankle or the foot. It can go to the front of the thigh and down to the knee. The further that the pain travels, the worse the problem. So one thing people get confused on is that if you've got any pain that's traveling away from the midline, your first goal is you've got to get rid of the furthest point of the pain. So if Brian's pain is the here, if he's doing anything that starts bringing the pain back up, he's doing the right things and correcting it. If he does any motion, movement, or activity that sends the pain down, it's the wrong thing. He's making the problem worse. So your first goal, you want to centralize the pain to the mid-back. And even if your back hurts a little bit worse, but the pain is gone that was traveling, you're still better. That's what you need to keep in mind. So in our next video, we're going to start showing you how you can start trying to manage this. If you have further questions, contact us at fitness4lifept.com.